Hi, I'm Sarah Chalmers. I'm a rural generalist and the president of the Australian College of Rural and Remote Medicine, and I'd like to introduce you to Dr. Tim Leeuwenburg, who's the chair of Sandpiper Australia.
Thanks so much, Sarah, for enabling this meeting. I'm really excited to be here signing off on this Memorandum of Understanding.
Thanks, Tim. I'm very pleased that we're talking together today about how our two organisations are working together to strengthen the role that rural generalists play in emergency response and disaster management, and in doing so, improving the health and wellbeing of rural and remote Australians. So we're here today to sign an MOU between ACRRRM and Sandpiper Australia, and recognising the two organisations' agreement to advocate and promote the training and inclusion of rural generalists in emergency responder networks and disaster management planning at a local, state and national level. I'd like to now ask Dr. Leeuwenburg to start off by telling us a bit about the Sandpiper organisation.
Sandpiper Charity is designed to narrow the trauma gap that exists in rural Australia. We have excellent ambulance and retrieval services in this wide brown land, but we also have rural generalists with advanced skills in emergency medicine and often anaesthesia. And we want a system to enable them to respond to emergencies in their local environment. And this will help, we think, narrow the time to early delivery of meaningful interventions. So what does that mean? Well, we need a system. And the Sandpiper Charity was established in the UK. It was born out of tragedy. There was a young boy playing by the water's edge who sadly fell in the water and drowned. And a local doctor attended the scene, but had no equipment to enable them to help. Now, the family, in their grief, channeled their efforts into trying to do something good. So they established a charity called the Sandpiper Charity. The sandpiper is a cheeky bird that plays along the water's edge. And what they've done is established a charity to supply over 1,250 sandpiper bags to rural clinicians across rural and remote UK. It's been tremendously successful, and it's now integrated into ambulance response systems across the UK. We're borrowing upon this model, and what we're trying to do is help communities raise funds to equip their local doctor with a sandpiper bag. This is going to be packed full of life-saving equipment and enable rural generalists to deliver early, meaningful interventions in that critical time before retrieval services arrive. So having the equipment is one thing, but having the training is another. And we're really pleased that the Sandpiper bag forms the key component of the ACRRRM Pre-Hospital and Emergency Care course, also known as FEC. So on the FEC course, interested rural doctors can gain hands-on experience using a sandpiper bag and applying it in a whole range of challenging situations. The idea then is that these clinicians will not only be able to deliver emergency skills, but do so in a way that supports local ambulance and ensures that they deliver meaningful interventions in a safe and reliable way.
I think this agreement is the perfect fit for our two organisations. Rural generalists have a clear role in emergency planning and management in the communities in which they live and work. Rural generalists are the doctors on the ground who understand the strengths, weaknesses and complexities of their clinical teams and their resourcing capabilities. This becomes so much more obvious the further away you move from major metropolitan centres. Some of our members live and work in communities that don't have fully resourced emergency services, and they may actually be required to attend traumas as part of their clinical role, often without appropriate equipment or training. In addition, they're more likely to be out on remote roads and tracks where the driving is part of their job, or perhaps taking their family out of their community at the start of holidays. Doctors attending the scene of a major trauma without proper training and equipment are less likely to be able to provide effective management, and a poor outcome can have a devastating effect on all involved. In other jurisdictions, we're unfortunately seeing an increasing trend for emergency response teams that fly in from major centres to bypass local practitioners and services. This doesn't make the best use of available resources and can result in less than optimal outcomes. In all these situations, ideally, what we want to see is rural generalists included on all local, state and national planning and response teams. By formalising our working relationship with Sandpiper Australia, ACRRM is demonstrating its commitment to continue to advocate for the healthcare needs of rural and remote communities.
Thanks very much to ACRRM for supporting the Sandpiper project. We're looking forward to working closely in the future and hopefully getting Sandpiper bags out to rural generalists in this wide Australian land.
Thanks so much, Tim. I'm very much looking forward to our two organisations continuing to work together.